he hasn't paid me anything for this. But Daniel comes from Bel Air. He went to Bel Air High School, lived a mile away, graduated, went to UT, where he studied, I think he studied business first, and then pre-med, where he met this amazing daughter with fantastic parents. They actually, once he graduated, they went to UTMB, where he graduated as a doctor. After that, he went to Denver to do his residency in psychiatry, where he eventually became the chief resident. After that, him and Laura being our daughter, went to live in Austin, Texas. Daniel worked at Fort Hood. He replaced that guy that killed all those soldiers, worked there for a while, and eventually left Fort Hood, went to Austin and opened his own practice. From what I understand, it's very successful, and he's got some unique ways of treating addiction. So I'll let Daniel talk about it. So here's Daniel Hochman.
All right, guys. Thanks for having me, Paul. Okay, well, yeah, thanks for having me, guys. Thanks, Paul. And yeah, I'm a psychiatrist. I've got a practice, and one thing after another led me to treating a lot of addiction. And it's a field that's been sort of outside of the realm of medicine, actually, historically. And so it's kind of a strange beast. It's not treated in a lot of the medical field. And hopefully over time that changes, but it's a strange thing, and a lot of people don't understand it. So I'm going to talk about some different things about addiction that'll hopefully be interesting, and we'll leave some time for questions. Let me just check, Paul, as far as the time, it's 8:20. Should I talk for about 20 minutes or so and then leave good time for questions?
Yeah, that would be perfect. And if everybody wouldn't mind typing their questions into the chat part of the program, I will feed them to you afterwards.
Okay, good. So before diving in, I like for people to understand the context of this. It's addiction affects just so many people. So about 1 in 10 people have some kind of addiction, and that's right now, right? That's not even over one's lifetime. So in any given year, there's also something called process addictions. So typical ones are like drugs and alcohol. There's then process addictions that deal with behaviors. And so when you include those, around 1 in 2 people are addicted to those kinds of things. And those are things like, I heard someone earlier, probably only half joking about, being addicted to sugar, but it's also shopping, the internet, could be sex, porn, gambling, all that stuff. So I call it just all the good stuff. When you include all that good stuff, it gets up to 1 in 2 people. And that number then is even higher if you look over across someone's whole life, right? So it's 1 in 2 at any point in time, but even higher across someone's life. And then the shame of all of it is that only about 10% of people with an addiction end up really seeking proper treatment and getting in somewhere. So that's the, it's a big problem, and most people don't end up getting help. So what we're going to cover here are a lot of the misconceptions around addiction. It's hard to really just dive into talking about addiction without knowing a lot of the misconceptions. We'll talk about how addiction develops, and then a particular way that I like to help people understand how addiction works, that's actually a pretty simple model. But surprisingly, a lot of people don't sort of see it that way and complicate things unnecessarily. So here are the myths. We'll just go over a few of these. There's a lot of myths, but picking some ones that tend to be most commonly misunderstood. There's a lot of people that will sort of go around saying that addiction is largely genetic. And it is true, addiction has some genetic component, but it is absolutely not a major cause of addiction. So one way of sort of proving this out is that you can stack the so-called addiction genes up, and you don't see addiction necessarily. So, if it was deterministic, you would see that, you could look at these markers for addiction, and you would supposedly then, be able to predict who has an addiction and who doesn't, and it just doesn't turn out that way. So the fact is that genes in general, the right way to understand them is not that they determine much of anything, and that they're rather just there to help with certain traits. So you might have genes to be tall, but you still have to eat the right diet. So like a lot of Asians that come over to America get much taller than their parents, because they're eating a very different diet than their parents did. Also, a way to understand that is, say, like, you could have an athletic person, you could have good genes for athleticism and be coordinated, but that in no way determines that you're going to, be a basketball player, let's say. So there's still a lot about who we are that determines who we are in the end. Also, genes always turn on and off. So I know we've got some doctors in the audience, but a lot of you might not know that, it's the same DNA that's in the cells for our retina, which is, different from the cells in our cardiac tissue, different than our brain matter, but it's the same DNA. So the reason that different proteins are expressed in different parts of the body is because the genes are turning on and off all the time, depending on what part of your body the genes are in, depending on what you ate, depending on all sorts of things. So genes are always being changed. They in no way could determine addiction because they get changed so much. We also have seen this pan out in primate studies, which is, it's easier to study primates than the complex nature of human development. So in primate studies, we've actually separated out and seen that you get the genetic markers that are the so-called addiction genes, and you stack all those, and those primates rear children. And then primates that don't have any of those addiction genes also rear their young primates. And the biggest determining factor by far in those studies is how warm and nurturing the mother is to their kids. So you can have all the addiction genes, but if it's a nice, warm, nurturing mother, and that might be in that study, for example, measured by how much touch and caress there is and how much breastfeeding, things like that, those primates don't have addiction. But then you can have the opposite. You can have a clean bill of health and rear that primate in a cold environment, and then they do have addiction. So that's by far the bigger factor. And also the fact that our genes that are getting exposed to the early environment of pregnancy are turning on and off genes all the time. So that really confounds a lot of the studies that might say, hey, the parent's addicted, and that's, the children have higher rates of addiction. But that does not necessarily prove out causation, because there's a lot of behavioral things happening that are getting passed down from a parent to child, as well as the fact that in pregnancy in utero, a lot of these genes are getting turned on and off. And then the most prominent researcher in this area, Lance Stotis, he has gone as far as saying there's no such thing as a gene for alcoholism. All right, myth number 2, brain abnormalities cause addiction. So I have a lot of patients, they come in and they say, I was just born addicted. I was born different, and they just remember they were just always different. It is true, we all have different brains. If you study any of us and put us through enough MRI scans, you will always see that there are differences between us. And so you can see a difference between an addict brain and a non-addict brain. But the fact that you can detect a difference, again, does not prove causation. So everything that we do at any point in life is technically having an impact on our brain matter. And so there's, a good way to illustrate this is you can take cab drivers before and after they get experienced and they're actually practicing driving a cab. So beforehand, you can look and compare the cab driver to be and a non-cab driver. And let's say they have similar brain activity in the mapping region of their brain. And then over time, over months of driving a cab, the cab driver's brain changes a lot. The spatial awareness in their brain gets very hyper-developed. It even starts to take over other parts of their brain, and they become very good spatially. So the spatial orientation is what drives our sort of spatial awareness on a map. And so the brain changes over time with that practice. But if you measure that cab driver's brain months later, you wouldn't say that his brain caused him to be a cab driver or caused him to be good at, reading maps. Instead, you'd see the causation there is such that the cab drivers simply developed a part of their brain out in a certain way, and you're only detecting that difference later on because of the experience. The differences that we observe for a lot of different things, but including for addiction specifically, are reversible. So when we have patterns of seeking pleasure and doing those sorts of things in addiction, those processes can be reversed, and then we don't see these differences in brain imaging persist. So that proves out that that brain, there's no such thing as a brain abnormality people are born with. The brain is much more resilient and adaptable than that. And then the next myth is addiction is a choice. So I know all of you will remember, the Reagan era. And it was Nancy Reagan started this big campaign, Just Say No. And so that really caught on. It was certainly an innocent thing. I don't pick on her at all, that it was bad thinking. But at the time, we just didn't really know. And so she was going around promoting this idea of just say no to drugs. And the fact is, that's not at all how it works. Addiction isn't this conscious choice. Addiction instead is something that develops out of a lot of things that come before that choice is made. So if a kid, is being sort of, peer pressured into, hey, take a hit of this, in that moment, whether they say no or not, is not at all influenced by a campaign like this. And researchers have done several studies of the Just Say No campaign, and there were just zero positive results from it. And the biggest reason that that's the case is that brain imaging shows we do not make a choice at the time that it looks like we do. Choices are generally made actually before we're even aware of it. So there are studies that will hook people's brains up to all kinds of circuitry, and you can ask someone simple or complex questions. You can say, "What's, what color, of this wall would you like, or what meal would you rather?" And the subject who's answering the question might say, I prefer the steak. But before they even say steak, seconds before, observers actually know what they're going to say. And that's just because there's actually stuff going on in your brain before you even say it, before you're consciously aware of what your choice is. So there's a lot happening before we even make a choice. And most of what we ever do in life, we think we're in charge and we think we're making our choices, but it's instead usually what's called an implicit choice, which is kind of a fancy way of saying it's automatic. So a lot of what we do in life is not coming with the full control that we think we have. And so I don't think of when we say no or make decisions about drugs as an issue of making a choice. It's not at all a logical problem, but a problem of consciousness. We need to grow more conscious of what sorts of factors lead up to what we say. Okay, so those are a few things that studies show does not cause addiction. So let's look at what does cause addiction. The first thing to understand here is that we're all wired with the addiction circuitry. I think a lot of people think of addiction as this thing that, like, an addict has the addiction circuit and I'm healthy, I don't have that, I'm different, I've got a clean bill of health. And that couldn't be further from the truth. We all have this set up for addiction. And not only is it available to use, we're all using it absolutely all the time, every day. And you can see here on the brain imaging, sugar lights up this brain pathway of addiction, even more so than cocaine. And so obviously we are driven to do things that are rewarding. Sugar is very rewarding. All kinds of things are rewarding. And we have to think of this more broadly than just being addicted to bad things, because we're addicted and motivated to very good things as well. So um, just kind of go back and ask yourself, like, if I'm going to design a body, whether that's, science, whether it's God, it doesn't even matter. If you're going to design a body and a mind so that it can be oriented to pursue things that are in its best interest, evolutionarily or in that person's personal interest, you have to have a mechanism to actually feel like those are good, rewarding things. We don't work on logic. You could tell me it's good, to eat food every day so that you stay alive. But we don't decide then to eat because we think it's a good idea, and that if we don't, we're going to waste away. We eat because it feels good, it feels satisfying, it feels rewarding. And so the things that keep us alive are very rewarding. That's going to be, things around food, shelter, procreation. It's going to be around security, being, secure in your environment. So like a home, but also secure socially. So we're very driven and rewarded to have all those things that are necessary for survival. And those have to feel good. So the addiction circuit is really just what we're using all the time to feel motivated and inclined to do things that either protect us or help us move forward in life. So it's what's behind motivation, reward, and also impulsivity. So we have to be impulsive a lot of the time. Say if you're going to get water at a watering hole, historically, you have to sometimes be impulsive enough and see yourself through the risks involved to get things, and especially going after prey, things like that. So addiction is not this sort of bad pathway or things, like a bad thing to have. It's really just an over adaptation of something that we all need. So what sorts of things do cause addiction? This slide here sums really all the research that we have about how addiction actually develops, if you're at all open to understanding it in a psychological sort of framework. So the three learned traits in addiction are going to be the most common pathways to just imagining this child going from, pristine innocence to, the pathway to addiction. And by far, the most common pathways are going to be a lack of belonging. It's going to be a poor impulse control and emotional distress. So emotional distress could wind up being a full-on clinical illness. So it could be, major depressive disorder, generalized anxiety disorder, panic disorder. But most of the time, actually, emotional distress, might just be just being upset about things, being sad, frustrated, angry with things. So it can be subclinical distress as well. And we'll go over some of even more particular how that can develop. So addiction begins way before we're actually given this choice, let's say as an adolescent, whether or not we're going to abuse drugs. It develops really, just from a few years old even. And some of the ways that you can develop out the traits that I had just named there are going to be these few things. And one is to have a very results-oriented way of growing up. So think about just your family that totally pushes results, and achievements. So, pushing grades, pushing, resume building types of things, and not necessarily giving much attention to the process and the journey. So you would maybe only, praise the grades that the kid gets, and not really praise, the effort and all that, discipline that it took, to even study in the first place. If it's always just about results, that person grows up to feel very empty because it's not fun, right? It's just all about, the grade, and it just feels like it's not worth it. Another way is growing up, learning that it's important just to always please other people. So, that would be a case where you've got, the role models really just sort of making it about them. And the child feels like they've got to do things right in order to keep other people around them happy. And in the process, that might sound okay, but, if you're doing that, what you're not doing is developing your own interests, developing your own skills, being able to monitor what it is you do and don't like. And so if you don't develop that, you grow up with a very low sense of purpose and meaning. And then another way is just a lot of criticism. So just always getting criticized for, being a little bit late, being a little, behind, not getting quite a good enough grade, not being as social, not being as good looking, all just critiques everywhere. And, enough of that happens and, the kid gets upset. They feel like their existence is somehow a little bit wrong. And that's another way you get some of those pathways to distress, impulse control issues, stuff like that. So the best way to sum all that up is really just life is not fun. Imagine these scenarios, and that kid is maybe doing life right. They might be getting good grades and being involved in a lot of activities, but they're not having fun. They're not really enjoying life. So what does it do to the brain? Remember I said, it's not that someone with addiction was born with this incredibly different brain, but nevertheless, when addiction develops, we do see that there are these pathways that we can track. And a stressful childhood is going to underdevelop that reward system. And what happens if you don't feel internal reward, you're going to seek it elsewhere. So if I don't produce enough dopamine in me to feel excited about life, then I'm going to find other very quick shortcuts to get that. Whether that means risk-taking sorts of behaviors or just a hit of a drug. Either way is going to give me this surge of reward and dopamine. And then it's a double whammy, because not only am I not making my own reward, I'm getting it from outside, but I'm also telling my body, if I'm going to keep giving myself reward and dopamine from the outside, then I can produce even less, because I come to learn I can rely on getting it very easily in these shortcut methods from the outside. So it's a double whammy. Now you really shut off your own reward pathway and you become even more reliant on addiction. And that's how that really, quick downward spiral can go. So we'll end here then with looking at, what are then helpful ways of understanding addiction? If you have anybody with an addiction in your life, thinking of a constructive and productive way to frame sort of, well, what are they going through, and what are some ways I can think about it? The classic definition that our biggest governing body on addiction is, which is called NIDA, the National Institute on Drug Abuse, their definition goes like this. It's a chronic relapsing brain disease that's characterized by compulsive drug seeking and use despite harmful consequences. That's, to me, kind of not only a dry sort of definition, but it's narrow, because we're talking in that case only about things that are having harmful consequences, and it's more around just drugs. So there's negative implications. And it even sounds critical to me from the start, because we're saying, well, this dummy is doing these things despite harmful consequences. So to me, it's a limiting sort of definition, although we could call it accurate. I instead like to use a definition that helps understand what's actually going on psychologically. And that would be that it's a learned pattern of seeking pleasure to escape intolerable emotion. So that helps us understand now, okay, this person with addiction, they're not just this dummy doing this thing over and over again, even though it's hurting them. Instead, we're trying to understand it with compassion, but also more accurate psychologically. This person has distress, and they have learned over time to look outside of themselves to seek pleasure and escape that distress. And so this is something I call the current of addiction. And this is something I've put together that really just incorporates a lot of different frameworks and good studies on how to understand addiction. And so it starts off in this current, and I imagine kind of like a current or a stream. It's starting with emotional pain. And remember, that could be major depressive disorder. It might also just be I'm pissed off about life or upset with some of the decisions they've made in life or the shameful things in life. Could be any sort of emotional distress. It starts with that. Anytime you are in distress, what the mind does quite automatically is come up with some craving. A craving, don't think about, only drugs and alcohol. A craving is just the mind's idea for how do I get out of this distress? And, a more benign craving might just be to have sweets, right? Just it's been a tough day. I'm feeling really overwhelmed. I'm really frustrated. Break open, the ice cream, the candy bar, gamble a little bit, surf online, porn, it could be anything to just escape the distress. And that's just an idea though, right? The mind's just coming up with an idea. It's only when we carry through with the idea that we would call it addiction. So to actually carry through with this idea and start drinking a lot, or eat yourself silly in the evening, that would be when the addiction actually starts. And very importantly, at the end of the current is that there's a false pleasure. So it always ends with this idea that let's say ice cream is going to take you to this euphoric state, but in a real addiction, the pleasure is very temporary. It's an empty, shallow, hollow sort of pleasure. And almost always that pleasure is a guilty one and a shameful one. So it doesn't end well. And that's very different than a healthy pleasure. And so, of course, then that just makes us feel worse, right? If you're drinking, and you're an alcoholic, it's temporary, right? You have some pleasure, but it's false. And now you feel worse about it. So now even more emotional pain. And so the current just goes in cycles over and over. So to be healthy is really to be outside of this current altogether. You would, when I work with people, you want to break down every part of that current, and not only break down every part of that current, but teach a way to live that is not even oriented around just trying to feel better. There's different ways of actually living. And a lot of people with addiction can't even imagine that. They're still just trying to transfer to healthier addictions. And a lot of them become like fanatics in the gym and things like that, or workaholics. So a lot of addicts do get healthy, but they're really just transferring. They're still stuck in this pattern of pain and escaping that with other obsessions and compulsions. So health is living in just a totally different way outside of that. But usually you've got to start by breaking down different components of the current. And if you look here, really, if you nail any one of these components, you can turn addiction off. So usually I'll start with like the addiction phase itself, and then work backwards to craving, the false pleasures. And emotional pain would actually usually be last, because frankly, that's the hardest one to remove. We have all kinds of pains when we go through life, and pains will just always continually come. Life is hard. And so that usually takes the most time of all this thing. And I think it's important to make sure we note that it's not always this super obvious thing. I laid out those pathways there of maybe critical parents, or parents hyper focused on the achievements, but it's actually in most cases usually pretty benign. So I've consulted at rehabs, and there'll be a subset of patients who are quote unquote typical. They've gone through sexual abuse, they've gone through other kind of overt forms of trauma, and they seem to really kind of get it, like, okay, finally someone's validating that could have led to my addiction. And then there's a lot of people who you go fishing around, and there's nothing overtly terrible. They not only did they not have any major losses or trauma or abuse, but you even ask, and they said, no, my parents loved me, they were always great, I had everything, I couldn't have asked for more. But with enough attention, it's not always on the parents, by the way. I mean, it's other role models, it could be things that happen with their peers, but usually people of close influence in their life, with enough attention and review, when you really get into it with those patients, you do find that there were just the right set of things that occurred where it's still their experience. For example, in those cases, maybe that sounds like maybe a high achieving kind of persona, where maybe good grades, well liked, active with sports and things like that. It doesn't need to be that the parents were just always, really, really over pushing all these, activities and achievements. It can be the circumstances that are just too aligned in a bad way. So if you have a very hypersensitive child, so we can be self-critical and then not be corrected by our peers or close influences. So we can still have an experience growing up where we have those things even without overt abuse and including verbal abuse and things like that. But there are other dynamics too. For example, being very overprotected is a common pathway to addiction. So that would be a case then where the parents are, you could think of as too good, right? They're shielding the child from adverse experiences. So, if they aren't studying much, the parents stepping in too much to either talk to the teachers or get a bunch of tutors. Same thing with other kind of trouble they might be getting into. And rather than the child learning, okay, there's consequences to these things and learning to self-monitor their behavior, regulate, instead they're being shielded from negative experiences, and they grow to be intolerant of distress. So when they do go out, to do life on their own, there's this so-called failure to launch, right? You finish high school, like maybe you're imagining with the friends, and they finish high school, they go on, they try to do things on their own. And as there's less and less structure and supports around to do things for them, they fail. And a lot of the times it's, one of the more benign examples is just they did not ever get exposed to the challenges and adversity that comes with being a grown-up. And so they fail, they grow intolerant of the distress. And so because they never got to practice tolerating and getting through difficult things, this is now their first time. And it's at a time where they have easy access to either, marijuana or other drugs, a lot of drinking, and they learn to use that, as their way of dealing with frustration tolerance, impatience, failures, setbacks, things like that. So hope that gives you an example of, ways that, either with overprotection from parents or just other ways that you can still be focused on results and things like that. And of course, there's many other nuances, we don't need to dive into right now, but a lot of other nuances, around why someone can just feel overall empty or unable to tolerate life's distress. So I'll stop there, and happy to answer questions as long as we want. So, I'd say it manifests and becomes expressed at, usually late adolescence. So, sometime, between sort of later high school and then shortly after high school, that's when it's expressed. But the thing I'd want to emphasize is that, it really begins well before that. So the momentum of that train, is set from just the earliest of years. Mm-hmm. And, if uncorrected, you're going into that addiction with a lot of steam. So that, when there is this appeal of some way to escape life's problems with alcohol, let's say, then there's a lot of momentum and inertia going in that direction. So it's, the first time you hear or experience addiction, the setup for it was years in the making. And that's why, it's not just this simple thing then, and you realize that, alcohol does you more harm than good and you decide to stop. There's a lot of inertia there that's gone into how you relate to life's demands, life's challenges and problems. So usually if you look back at someone with, starting with a budding addiction at, 18, there's been years before that where that child was not really tolerating life's problems. Yeah, really almost none of those are. There's a proposal for the ICD system to have instead of just sexual disorder, they're proposing that there's going to be a sex addiction. And that's then hotly debated too. What do we include in that? Is it actual, I call human sex, or is it also porn? Is it internet sex? Is, you know, there's all kinds of questions, and then quantifying, you know, what constitutes sex addiction. You know, you ask one person and it's a very different number than, you know, or frequency than the other person. And so you're going to go by criteria of, you know, amount of something. And this goes for sugar as well. This goes for the other process addictions. You know, how much sugar are you going to say is a sugar addiction? So that's where it breaks down. And although psychologically it's extremely valid, and I have good success, you know, to back this up, you know, it's extremely valid to treat those process addictions like we do other addictions. If you use the kind of model we're talking about, where we're treating addiction as though it's something to do with their frustration, tolerance, and impulsivity, then it's valid to treat those process addictions in a similar manner. But as far as just strictly DSM, those process addictions are not in there because they're hotly debated, but also just genuinely difficult to make criteria for. Because like I said, whether it's porn, sex, sugar, shopping, again, you know, one person is going to say this much shopping is an addiction. The other person's going to say, no, that sounds like a normal weekend to me. So you can't nail down the frequency and amounts for those process addictions. And on top of that, then if you're going to say, okay, forget the frequency, let's look at the relationship to those. So how compulsive is that shopping? How much are you using the shopping to escape life's problems? Again, then we don't have good scales that rate that. Clinicians aren't used to using that kind of framework. So we are not even close in my mind, you know, to being able to agree on criteria. And you know, people who do studies, the doctors in the audience will know we can't really properly study and get prevalence on things and look at outcomes for different treatments until you first agree on what are the criteria for an illness. If you can't agree first on just the basic premise of what constitutes an illness, you can't study it. So a lot of the times, the criteria we have for medical illnesses are really more for research purposes, even, you know, functionally than what we do with it. So, for example, if I have someone that's sad, you know, that's not a difficult diagnosis to make, that they're either dysthymic or they have major depressive disorder. That part's easy functionally. That's a lot of that, you know, criteria is really there just for research purposes, so that we can research and agree upon, okay, what are we calling major depressive disorder, so that we can then go on and study medications and different therapies. So that's why I say we're far from agreeing on or being able to study process addictions. I have my own little practice. It's just me, and I think I had, you know, some good experiences working with people who were leaving rehabs, and so places would sometimes send their patients to me after they couldn't get better or left their rehab and stuff, and they had issues, you know, helping get through to them. And so the success I had using this sort of approach really worked, and I just have to turn down patient after patient because it's just me and my practice. So I said, well, I'm just going to record the methodology that I use and let people from anywhere in the world access it. And it's been a pleasure. I mean, there are now people from over 20 countries that have found it and dropped me the nicest notes ever, and just they get better from their own privacy of their own home. So there's a lot of aspects to it that it's you know, going to actually treat them like a decent human being who just needs some different training of how they deal with their emotions. So it's a very relatable thing, and it's not shame-based at all. And then one of the other special things about it is it's very private. So with the program, you get to just enter as the regular person you are who has some struggles and deal with your issues that you're shameful about in a private manner. You never want to publicly, you know, you don't want to start a shameful process publicly. So a lot of people, you know, enjoy the fact that it's just, you know, they can do it in their own privacy and not out themselves to their employers and the world. So yeah, it was a culmination of a lot of those things that motivated me to do it. Yeah, yeah. I mean, these are hard to nail down, but you know, if I had to guess, I'd say, you know, addiction might be around 10% genetic, something like that, right? So not the 50 to 70% that might be espoused. Um, but remember, you know, here's, you know, some way to think about it. You might have the genes for addiction, but what does that mean, right? There's no such way you can have a gene that causes you to drink too much. Instead, really what we're saying is the gene might make you more impulsive. The gene might make you frustrated more easily, something like that. Okay, and if we agree that that's really what we're saying, well then um, we're not saying it causes addiction, right? We're just saying it increases the chance of some trait. But let's look at like impulsive or risk taking. That same gene might also be the exact same gene that makes you be an entrepreneur or a good investment, you know, trader. Something, you know, like that also involves taking risks and or sometimes being impulsive. So there would be increased tendencies for certain traits, but never would it be that it determines that you're addicted. And yeah, there's of course a genetic component to how much, you know, alcohol we can handle, things like that. But again, that doesn't pan out. You know, we can't predict if someone's going to drink too much because they can tolerate more alcohol. It's not as if, you know, so Asians, you know, have a much lower tolerance for alcohol. That doesn't necessarily help or hurt, you know, whether they drink. That might affect how much you can drink before you get drunk, but that has no determination on whether you're an alcoholic. I'd say like almost all. Yeah. I mean, that, because that's where I'd say just addiction is really when you're growing up in a way where life is not fun. But yeah, I mean, whoever asked this, it's a very good philosophical discussion around there's really I take the lead in inside self recovery. There's even, you know, some lessons on there. You know, there's type 1 and type 2 kind of joy or fun, and those actually come from the adventure world. You know, where going on a nice pleasant walk or seeing a sunset, you know, is one kind of fun, right? And then there's another kind of fun and joy or happiness that comes from a real challenge. So like a camping trip or something where you're getting mosquito bites and it's cold and then, you know, you're tired and everything. But there's a certain other kind of pleasure that comes from that. And that's a pleasure that comes out of tolerating distress and coming out on the other side. That's the journey of life. That's a microcosm of what can happen over, you know, the larger life that we lead. So yeah, absolutely. It's around this delayed gratification. It's around the way we relate to life's problems and challenges and pains, the losses we have. Yeah, absolutely. It's around, you know, we're not entitled to a life of just great freedoms and joys only. You know, it's having to, you know, accept that, you know, life is not just about evading problems and just feeling good. It's that, you know, we have to experience the full range of what it is to be human, essentially. So yeah, that absolutely gets at the heart of the matter.
Thanks, Daniel. Joe, over to you.
Yeah, thanks, Daniel. Thanks very much.
Thank you.
Very enlightening. Appreciate you make the time available to speak with us tonight.
Thanks for having me.
Thank you.